Welcome everybody to part 4 and the most important episode of the Neurotrauma Guide. If you haven't watched the previous 3, I highly recommend it, and today we'll be getting into trauma surgery, which is the general term for most operations that have to do with emergency response, are life-threatening, or were caused from an attack from bullets or Europa's native life. There's an infinite and one ways to get injured. By the end of this course, you should know how to perform life-saving surgeries combined with your previous knowledge to get your ally back on their feet. Before I explain how to perform these surgeries, I'll explain to you how to use your equipment from a quick recap on your surgery basics to some new items I'll get into later. To recap, these surgeries require an open and closed surgery, which means performing open surgery and closing with the suture when you're done. Your first tool is your scalpel. The scalpel is used to make an incision on any limb. It'll cause your patient to start bleeding. Next is the hemostat. This tool stops the cut from bleeding and allows you to use your next and final tool in the set, your skin retractors, which holds the skin open so surgeries can be performed. These are the basic tools required for open surgery. Remember, to reverse the effects of these three tools, use a suture on the opening and the opening will become closed again. Now for your health scanner. This is an important tool for diagnosing patients. Although it's important to know how to identify problems at a glance, sometimes it's not an option and you need a definitive answer about something. That's where your health scanner comes in use. It needs a battery and will read every affliction on a specific limb when used on your patient. You can also use your health scanner by holding right click, then holding left click. You'll see this green area. Any patient in this cone will have all afflictions read out as if you have the medical officer's health goggles on. Be careful not to use this too much. It will cause radiation damage to both you and your patient, so use it sparingly. Next is your hematology analyzer. This tool will tell you everything about your patient's blood, from their blood type, blood loss amount, blood pressure, to blood sicknesses such as acidosis, alkalosis, and sepsis. Use this to get information about your patient's blood, to track the progress of illnesses, or to monitor your patient's blood loss. Next is your defibrillator. There's two kinds, manual and automatic. The manual is the one you start out with, and its effectiveness varies depending on your medical level. I'll go into how NT Surgery Plus changes items like these in a dedicated video. The manual defibrillator will reset your patient's heart to sinus rhythm, which means it will reset back to a normal rhythm. Use the defibrillator to reset your patient's heart if their heart rate reaches the stages irregular heartbeat or cardiac arrest. These afflictions are shortly referred to as fibrillation. Will be explained later in the video as well before getting into operations. Next is the automatic defibrillator, which is an unlockable recipe. This defibrillator is much more beginner friendly. It will always successfully restart the patient's heart. However, it's less effective and takes longer to activate, so if you have an assistant or trusted friend that can help you, this is the perfect item for them. The manual defibrillator may not be a good item when you're starting out, but as you raise your medical level, the manual will become much better than automatic, and when it can be consistently used successfully. Always use this one instead. Something to note about the defibs is that they take a lot of battery on use, so make sure you have some extra batteries laying around. Next we'll cover the Ambu Bag. The Ambu Bag requires an oxygen tank to function, and what it does is heal the affliction oxygen low, and additionally, in general, will make your patient breathe if they're not breathing on their own. Use the oxygen tank if your patient is suffering from oxygen low, hypoxemia, hypoventilation, or respiratory arrest. We'll get into respiratory arrest after I cover fibrillation later, but I'll explain that respiratory arrest can be automatically cured if your Ambu Bag is loaded with an oxygenite tank. So if you want to be extra prepared, have one of these laying around for emergencies. The Ambu Bag is a great tool for dysfunctional lungs, traumatic shock, saving a patient from drowning. Finally, we'll cover the Autopulse. The Autopulse is a great tool, but its use case is a little conditional. The tool is used to over time reverse the effects of cardiac arrest and will additionally negate the effects of respiratory arrest. However, this tool isn't always available to use as it goes on your patient's armor slot to be used, so don't try to use it if your patient is underwater or the room is flooding. Always keep an additional diving suit in your room to throw on your patient in case your medbay floods, by the way. This tool is good for managing your patient's heart and lungs for you if you don't have time to worry about your defib or Ambu Bag, but it won't give as much good results as managing the two yourself. Though in some situations, you need to worry about other things, so this tool allows you to multitask well. The Autopulse requires battery to use, but it drains battery quite slowly, so you shouldn't have to replace it too often. Never leave it on longer than you have to. It can cause your patient's blood pressure to rise over time, and that's not a good thing, so take it off when you're done or you think your patient is about to become conscious. It can get stuck on them if they gain consciousness and is still on them. Next, we'll cover your tweezers. Tweezers are a tool used to extract foreign objects from your patient's body and cures the foreign body affliction. It removes 5% of the affliction on each use. Tweezers can either be used through an open surgery on a limb or straight into an open wound, such as a gunshot wound or openings left from something like a frag grenade. Using the tweezers after performing open surgery on the limb is the safest option and causes the least problems, but it takes a while to set this up. Another thing you can do is say your patient was shot in the arm. You can remove the bullet straight from the wound. This will cause a small amount of traumatic shock, but it's much better for emergencies. The traumatic shock will go away on its own quite quickly, but just be careful if you use the tweezers too many times at once in an open wound. You may have to spend a little extra time or effort on your patient's heart and lungs. Finally, we'll cover sutures. But it also has the function of closing wounds. The wound sutures can close our lacerations, bite wounds, bleeding, gunshot wounds, and deep tissue injuries, to name a few. It will reduce the damage from most open wounds from around 10%, and it will close a lot of bleeding at once, though you may still need to use sutures a couple times to fully close it, which is why I recommend you have so many on you at all times. Forgive me for not knowing this part fully, but using sutures on an open wound will leave the stitched wound affliction, which isn't a lot of an issue, but it slightly damages your patient. It's worth the trade, of course, though. Stitching a bite wound that takes away 30% of your patient's health fully stitched will be reduced to maybe 5 to 10% of your patient's health. Will go away on its own over time. The part I'm unfortunately unsure of is if this is vanilla, Neurotrauma fork, or Anti-Surgery Plus. Just know if you encounter it of what it is. The only way to heal stitched wounds is pomegranate extract, to my knowledge. If you want to be meticulous, that is. There's a few more items to cover, but I'll cover them when they're relevant, as their use is niche or self-explanatory. I'll try to keep this lesson short. The heart has 3 stages: increased heart rate, irregular heart rate, and cardiac arrest. Increased heart rate is a kind of tachycardia and is the first level of fibrillation. It's harmless but can be a sign of blood loss, sepsis, acidosis, which was covered in the last course, and can also mean pneumothorax, adrenaline, or alcohol withdrawal. It's just a symptom, so don't worry about fibrillating this. Next is irregular heartbeat. Irregular heartbeat means the heart is beating faster than it was made to be able to handle and can cause hypotension or cardiac arrest at late stages. If a regular heartbeat goes over halfway in its progress or is increasing quickly, this is a good time to defibrillate your patient. Finally is cardiac arrest. This means your heart is in an asystole rhythm, which means not beating at all, also known as flatlining. I know seeing this on your patient may give you a great deal of anxiety, but don't worry, your patient's not dead, far from it if you're vigilant. Immediately defibrillate the heart and it will restart. The Autopulse also works, just slower. Use it if your skill isn't high enough for your defib or it doesn't have battery. If your Autopulse isn't an option, use CPR. It's the slowest method, but it gets the job done. A little blunt force trauma is worth getting your patient's heart to beat again. Cardiac arrest is caused by 100% heart damage, traumatic shock, coma, hypoxemia, and failed manual defibrillator skill check, and is the final stage of fibrillation. So it can happen if your heartbeat exceeds the irregular heartbeat stage. It can further the effects of a coma and hypoxemia and causes hypotension and acidosis. Prioritize getting the heart beating. I'll briefly go over heart attacks now. They're caused by extreme hypertension, around 150%, or failing to use antibiotic glue, which honestly, you shouldn't be using anyways. Treat them with nitroglycerin or streptokinase. I would recommend nitroglycerin, however, as streptokinase is a bit more expensive. Heart attacks are a major emergency, so prioritize them if you spot one. You'll know a patient is having a heart attack if they have shortness of breath or sweating. If you spot either of these, immediately use your health scanner on your patient's torso. If they're having a heart attack, lower their blood pressure immediately with the blood bag or sodium nitroprusside, and find nitroglycerin or streptokinase ASAP. Heart attacks cause a lot of damage to the heart, and if heart damage reaches 100%, the heart will fail and stop beating no matter how hard you try to get it back. Now we'll cover the lungs. Shortness of breath is a common symptom. It doesn't cause anything on its own, but it can be a sign of hypoxemia, lung damage, heart damage, pneumothorax, hemotransfusion shock, cardiac tamponade, or a heart attack. Shortness of breath can't be treated. Next we'll cover hyperventilation, which is a fancy way to say breathing too fast. You've probably heard of it before. It can cause alkalosis and is treated by slowing your patient's breathing. Giving the analgesia effect with opium is usually the best way to do this, though I wouldn't worry too much about treating it. It's not a big issue. You'll spend your resources better treating the cause instead. It's caused by hypotension, hypoxemia, adrenaline, sepsis, or pneumothorax. Next is hypoventilation. This means your patient isn't breathing fast enough and can be treated by inducing hyperventilation. You can do this by giving your patient adrenaline, but you really shouldn't worry about that. It's not much of a problem at all. It can be caused by the analgesia effect or anesthesia, which is an effect gotten from the medicine propofol. Finally, the worst case lung scenario is a respiratory arrest, which means your patient isn't breathing. Use your Ambu Bag to treat this, and use it with an oxygenite tank for a single use to cure it instantly. And trust me, you'll want to get rid of this quickly. If your patient isn't breathing, the organs will all quickly die, including their brain, so treat it fast. Even if all you have is a normal oxygen tank, use it anyways and keep using it until it goes away. It's caused by traumatic shock, lung death, and neurotrauma if it's high enough, and will cause the acidosis infliction. We'll start with comas. A coma happens when your patient is unable to breathe after too long. The only way to treat a coma is to solve any lung issues, get air in your patient with the Ambu Bag, solve any heart issues, namely cardiac arrest, and it can also be caused by strokes or acidosis. A coma will leave your patient unconscious and unable to move or speak for quite some time depending on how high of a percentage it's at. It's best to monitor your patient's heart and lungs while they're in a coma, because it's possible the coma can cause their heart to stop. We'll now discuss strokes. A stroke is when there's a bleed in the brain, which in this mod can happen due to blood pressure. Hypertension is covered in the blood video, but in short, if blood pressure is too high for too long, the patient can have a stroke. A stroke will quickly kill you, and the only way to cure it is open and close surgery. Scalpel, hemostat, skin retractors, suture. Strokes can cause a headache at first, then seizures, a coma, and finally a lot of the neurotrauma affliction, which I'll explain now. Neurotrauma refers to brain damage. It can go up to 200%. If it does go that high, your patient will instantly die. It is the main cause of death in the mod, and you need to be extremely vigilant about it. Neurotrauma heals over time, but an additional layer of healing can be brought by the medicine Mannitol, which I will cover after explaining the affliction. It's caused by organ-damaging problems such as sepsis, liver and kidney damage, as well as heart and respiratory problems. Anything that would include blood not getting to the brain or air not being in the blood. These are problems such as cardiac arrest and respiratory arrest. As discussed in the bone video, skull fractures over time will build a large amount of neurotrauma, and other problems that can cause it is stroke and traumatic shock, medicines such as meth or hyperzine, poison cyanide, and I think it can also be caused by putting a tourniquet on the head, as blood flow will be cut. In short, keep oxygen in your patient and keep blood circulating, and please don't give them hard drugs or cyanide. That's not very nice. You've probably heard me bring up vanilla organ damage a few times and wonder how it's different from named organ damage. Basically, in vanilla barotrauma, you can sustain organ damage from being under a lot of water pressure. And like other afflictions like bite wounds, gunshot wound, blunt force trauma, lacerations, so on and so forth, it carried over into neurotrauma as well. So when I say organ damage, or vanilla organ damage, that's the one I'm referring to. When I say named organ damage, I'm referring to heart, lung, kidney, or liver damage. So how do you cure vanilla organ damage? Well, time mainly. But the medicine Deusizine is also available, which I'll cover in the next section of this video, where I'll talk about important medicine. Organ transplant surgery is also an option, but we'll get to that later in the video. Commonly, vanilla organ damage is caused by broad-spectrum antibiotics and mannitol, but it can also be caused by meth, probably hyperzine, but I'm not sure on that one. Just please avoid giving or using meth. It's really not worth the momentary benefits. Vanilla organ damage, like neurotrauma, causes direct damage to your patient's health, so see through it's treated, or at least try not to make it worse. Internal damage is separate from organ damage and is located on individual limbs, so each limb with internal damage must be treated individually, unless using Deusizine. It's caused by dislocations and fractures mainly, but it can also happen when failing some tools like tweezers, skin retractors, your drill, saw, sutures, or any kind of implants. Treat internal damage with open surgery, scalpel, hemostat, skin retractors, then use tweezers until the damage is gone and close it with a suture. Internal damage does direct damage to your patient's health bar, so treat it fast. It can cause organ damage and named organ damage, as well as give you problems like a pneumothorax or a concussion, depending on where the internal damage is found. Now to go over named organ damage. The named organs are the heart, lungs, liver, and kidneys. They all have their own health bars, and you can see their health percentage with your health scanner on your patient's torso. We'll start with the heart. The heart pumps blood through the body and has a total health of 100%, just like all the rest of the organs. If you see heart damage or any other named organ damage, use thiamine to treat it. More about thiamine in a moment, as I said. And if heart damage reaches 100%, you must transplant the organ by giving your patient azathioprine, performing open surgery, scalpel, hemostat, skin retractors, then using your heart scalpel. Depending on if you use anti-surgery plus, you may not start with a heart transplant scalpel. So if you don't have transplant scalpels, buy them at the next outpost you visit. They're not that expensive, so don't worry. Once you use the heart scalpel, the heart will be removed and your patient will stop circulating blood, so quickly add a replacement heart by double-clicking the transplant or dragging it to your patient's torso. Then close with the suture. Heart damage can be caused by antibiotics, mannitol, sepsis, hypoxemia, radiation sickness, hemotransfusion shock, liquid oxygenite, and heart attacks. You can spot heart damage from coughing, shortness of breath, and leg swelling. If your patient's heart fails or reaches 100% damage, the heart will stop and won't work again and requires a transplant. Next I'll cover lung damage. Lung damage is cured with thiamine or a transplant at 100% damage. It is caused by the same things minus heart attacks, and additionally is caused by using an Ambu Bag with a welding tool or paint in it. Please don't put either of these in your Ambu Bag. It can cause coughing, shortness of breath, and an unrecoverable respiratory arrest at 100% damage. Next is the liver. The liver is surprisingly one of the deadliest things that can fail. It is treated with thiamine or a transplant surgery at 100%. It's caused by antibiotics, hypoxemia, sepsis, radiation sickness, hemotransfusion shock, and liquid oxygenite. It can cause leg swelling, hypertension, neurotrauma, abdominal discomfort, bloating. The symptom jaundice is a dead giveaway the liver is dying and your patient will turn yellow. This happens at 80% liver failure, and if the liver reaches failure, it will cause internal bleeding and vomiting blood. Finally, the kidneys. Kidneys are healed with thiamine, and kidney death needs a transplant. Kidneys are unique in the sense that there's two, and each kidney can die. If kidney damage reaches 50%, one kidney will die, and if it reaches 100%, both kidneys will die. You can survive with one kidney, though it's wildly inconvenient to do so. Kidney damage is caused by broad-spectrum antibiotics, mannitol, radiation sickness, sepsis, hypoxemia, hypertension, hemotransfusion shock, and liquid oxygenite, and causes leg swelling, acidosis, hypertension, nausea, vomiting, bone damage, and neurotrauma if both kidneys fail. As I said before, I'll go into depth about Mannitol. Mannitol is a risk-reward medicine that's the main treatment for neurotrauma. Over a short time, it will cure a lot of the neurotrauma affliction, but it comes with the downside of damaging your organs, those being vanilla organ damage, or just organ damage, and heart and kidney damage. So only give mannitol if you absolutely have to. Try not to use it if any organ damages go above 70%, but if neurotrauma goes anywhere close to 150, use it anyways, and always prescribe it with thiamine, just like you would with broad-spectrum antibiotics. Mannitol will have no effect if the patient's blood pressure is under 70%, so also prescribe Ringer solution if you need to, and fix any blood loss. Speaking of broad-spectrum antibiotics, I covered them in the blood video, but I'll recap here. Broad-spectrum antibiotics are the only treatment for sepsis, and will cure it quite quickly, but do be aware that it causes a mass amount of organ damage, some organs taking around 10% total damage, and others taking around 20% damage. So be careful prescribing this, and always prescribe it with thiamine. Thiamine is also something I covered in the blood video, but I'll go more into depth here. Thiamine is your best friend. If anything goes wrong, thiamine needs to be in your kit no matter what. It heals organ damage by 8% over the span of a couple minutes, which isn't a lot, but it's the only way to treat it. Hypertension, sepsis, neurotrauma, mannitol, and antibiotics are just a few things that cause named organ damage, especially with mannitol and antibiotics. You have to weigh the risks of damaging your patient's organs to cure whatever affliction you need either medicine for, so they should always be prescribed with thiamine. It may not solve the problem quickly, but it's better to have them than not. Keep in mind though, thiamine will not heal an organ that has failed or is at 100% damage. Remember, organs naturally regenerate on their own. Thiamine is just a booster. but you need every second of that booster you can get your grubby medical hands on. Organ damage can heal with time, but is slow, and vanilla organ damage deals direct damage to your patient. So if you're in an emergency and your patient is fading fast, use the medicine Deusizine. It's a little expensive, but it'll heal a lot of vanilla organ damage, which should give your patient a lot more help and you a lot more time to work with. So save it for emergencies. Although that's the main use in neurotrauma, there's a few others. It will help cure internal damage, it will cure hypoxemia, and something I should have brought up in the blood video is it will treat an amount of blood loss. In short, Deusizine is your miracle medicine if things start going really bad. Make sure you have some. I covered sodium nitroprusside in the last video, but I'll cover it again briefly. Sodium nitroprusside will drastically lower your patient's blood pressure for a while. The best way to lower blood pressure in a pinch is to take some of your patient's blood. But sometimes a situation comes up where your patient has extremely high blood pressure and already has blood loss, and that's where this medicine comes into play. It will give you the blood pressure reducer's affliction, which will lower your patient's blood pressure. It actually does this so effectively, it can cause low blood pressure, but trust me, you're gonna want low blood pressure over extremely high blood pressure. If you need to raise blood pressure quickly, remember you always have Ringer's solution. This should cover all of the general emergency medicines you have in your kit. Now we'll finally begin operating. We'll begin this section with concussions. Concussions happen when you receive massive damage to your head, usually from explosions or blunt force trauma, or it can happen at random chance if you have internal damage to the head. Concussions make your vision blurry and can make your patient nauseous. Unfortunately, the only treatment for a concussion is bed rest, and the concussion will slowly go away on its own. Get your patient in a normal bed or bunk and monitor them as they rest it off. Now we'll move to drowning. Drowning causes oxygen low and hypoxemia, of course. These afflictions are best cured with an Ambu Bag. There are a few medicinal alternatives, such as liquid oxygenate to quickly reoxygenate the blood, or adrenaline to make your patient's heart work harder and make their unconsciousness momentarily go away, depending on how quickly it's given. But the best solution is to give your patient oxygen with the Ambu Bag. Since the oxygen low affliction quickly causes neurotrauma, it's important to act quickly. Neurotrauma percentage in a moderate amount can cause cardiac arrest, so there's a good chance you'll have to monitor your patient's heart. There's two ways to go about this. Constantly use your Ambu Bag and Defibrillator until the afflictions are no longer getting worse, or use your Autopulse to monitor the heart and the lungs for you. Just make sure you have something to lower your patient's blood pressure just in case. Additionally, if you need your patient quickly back up or don't have the time to wait and monitor them, prescribe Mannitol with Thiamine while giving them air with the Ambu Bag. If you don't have time to use your Ambu, liquid oxygenate is a solution for that. I'll demonstrate these two methods now. I recommend having the skill of Fireman carry as soon as possible, and if you're using the Anti-Surgery Plus mod, get the skill Adrenaline Pump. This will allow you to move patients at full speed and make rescuing them from these kinds of situations much easier. Obvious signs of asphyxiation, which can come from drowning or not having an oxygen tank in your diving suit, is shortness of breath or respiratory arrest, as well as fibrillation from irregular heartbeat and even up to cardiac arrest. You may also see dizziness and a headache. The main thing oxygen low causes is hypoxemia. Always have a planned path to quickly get to your patient and get out. Be light on your feet and always be careful of surrounding threats. Don't try to rescue a patient in waters where you're going to find mud raptors or crawlers or anything of the like. Bring a security officer with you, or at least someone armed when going to save someone. Next we will cover radiation sickness. Radiation sickness can be caused by radiotoxin, nuclear explosions, like when you put too many fuel rods in a reactor and it explodes, or overusing your health scanner. Radiation is simply treated with anti-rad, and I would recommend using everybody's favorite medicine, Thiamine, with it. Radiation sickness at around 30%, give or take, causes all of your named organs to quickly take damage. If radiation sickness gets bad, your patient will have a seizure. If it gets really bad, your patient will get nausea. Both of these are symptoms and do not cause any problems themselves. Theoretically, a seizure can cause your patient to stop standing and fall, which in bad situations can lead to blunt force damage or drowning for a moment. Since radiation sickness does so much damage to your named organs, it's important you give thiamine. Named organ damage heals the slowest by far, so you need to keep it as low as possible at all times. Additionally, you can use Deusizine if you have absolutely no anti-rat anywhere, but don't expect it to be very effective. Deusizine is a broad-use medicine that will heal a small amount of most kinds of poisons. This includes radiation sickness. Now we'll cover burns with my assistant Mari. Burns can happen mostly from fires, being shot or attacked by some weapons, and failing engineer skill checks, so expect these a lot early game. Additionally, they can be caused by the medicine Deusizine, which will inflict you with first-degree burns. There's 3 degrees of burns: first, second, and third degree. First degree burns are the easiest to treat. The quickest option for these burns are bandages, although they won't heal much of the burn, and the bandage will become dirty, which could cause infection if left on your patient. So a more expensive but more effective alternative is antibiotic ointment. Antibiotic ointment will heal a large amount of first degree burns with no drawback. Next is second degree burns. Second degree burns are when burns can become dangerous and can cause your patient's limb to become infected, which can cause sepsis. So this is an important stage to intervene. Treat it the same way you would first degree burns. It may take a second dose of ointment to fully cure, but I would just recommend getting it down to a first degree burn and not worrying about curing at all. It will go away on its own eventually. Finally is third degree burns. These are dangerous burns and can quickly cause infection. In this stage, you must perform a small surgery on the limb you want to operate on. Use the scalpel, hemostat, skin retractors, then use plasticine on the limb and close with the suture. This will fully heal a third degree burn. Make sure the surgery is done in the safety and cleanliness of your med bay. Burns deal direct damage to your patient, so it's important they're dealt with. If your patient is badly injured and they need some health back, it won't hurt to treat their burns to give them a top up and give you more time. Treat third degree burns quickly, and remember, don't let your captain try to do engineer's job because they're not doing it fast enough. Trust me, the surprising amount of ointment I lost at that. This section will cover all to do with the most deadly afflictions and afflictions you may get after a dangerous situation or a combat scenario. First thing we'll cover today is cardiac tamponade. Yes, that's how you pronounce this. Cardiac tamponade is found only on the torso with the health scanner and requires an open-close surgery to fix, which means you need, in order, scalpel, hemostat, skin retractors, then a suture. And remember, you can't start a surgery without opium or morphine, which cause the analgesia effect that allows you to begin operating. This is the most simply treated out of all major emergencies as it only requires this basic operation. A cardiac tamponade is caused by taking heavy damage to the torso or being shot in or around the heart. It means blood or other fluids has entered your pericardium or a sac around your heart and is causing your heart to struggle to properly beat. It causes symptoms similar to heart attacks or blood loss, causing shortness of breath, coughing, weakness, and hypotension. This is a major emergency and requires immediate medical attention, so make it quick. Next we'll cover pneumothorax. You're going to run into this one a lot as it's the most common thing to run into. Pneumothorax is caused in the same ways, from receiving heavy damage, being shot in the torso, but can be caused by some other sources, such as bites. It can also be caused by fractured ribs, with a random chance to happen every few seconds if the fractured ribs aren't treated or at least bandaged. For this you require a scalpel, hemostat, skin retractors, drainage, and then a suture. This will immediately cure the pneumothorax, although some afflictions caused by it will take longer to go away. A pneumothorax is like a cardiac tamponade, just for your lungs. It's a blood or fluid buildup in the pleural sac, or a sac around your lungs, causing your patient's lungs to be unable to inflate properly. So this affliction is only visible with the health scanner to the torso and shows the symptom shortness of breath, and the afflictions hyperventilation and increased heart rate, which can lead to fibrillation issues. The most common thing you'll see as a result in pneumothorax is a high content of alkalosis, so check for it after you've spotted and cured pneumothorax, and treat it if you see it. There will be a chapter in the blood video you can check out to know more about alkalosis, but it can be treated easiest with drawing your patient's blood with a blood bag and prescribing saline. Another way you can treat pneumothorax is with a needle. The needle will keep pneumothorax from causing any problems, though it will never make pneumothorax go away on its own. It's a great option if you're outside of the sub and don't want to or don't have the time for surgery. The needle lasts quite a while, so as long as you're back in the sub within, I would say 5 minutes, it should work fine. Pneumothorax is a mild emergency. It's not life-threatening, but it's very inconvenient. Now we'll cover aortic rupture. You may remember this was covered in the blood video, but I didn't want to leave it out of this video since it applies to both subjects, and I'll go much more into depth on it here. It can only be spotted on the health scanner on the torso. If it's spotted, it needs to be treated immediately. If you're not close to the sub, do the operation anyways. If it's spotted, take these steps: opium, scalpel, hemostat, skin retractors, endovascular balloon, medical stent, suture, and around 3 blood bags after. This is one of the fastest killing afflictions you can come across, and it's made much more deadly with the fact that it can only be seen with the health scanner. Aortic rupture can be caused by damage to the torso accompanied with foreign bodies in the torso. It's a rare affliction, but you should be thankful it's so uncommon. Aortic rupture will cause extreme internal bleeding, which can be spotted by pale skin or throwing up blood. It can cause extreme high amounts of internal bleeding, which is why it requires so much replacement blood. If you give 3 blood bags and your patient's blood loss is still above 35%, give another bag. Worry about replacing that blood later. Your patient's life is much more important than your blood bags. Additionally, it can cause fibrillation. Internal bleeding itself also causes fibrillation, so in other words, your patient's heart is going to be getting really fast, really quickly, and can quickly and easily lead to cardiac arrest. Treat cardiac arrest. If the surgery is done outside of the sub, it's very likely your patient will gain a lot of traumatic shock, but it's way less lethal than aortic rupture. So carefully monitor your patient, use your Ambu Bag and Defibrillator when necessary. After an operation, always make sure you check your hematology analyzer for acidosis, alkalosis, or sepsis. If you must get your patient back to the sub, use a stasis bag. The stasis bag will stop your patient's heart and lungs from working, but will minimize blood loss issues and should buy you time to swim back with your bleeding manfish. An amputation must happen if your patient has one of two afflictions on a limb: gangrene or traumatic amputation. This section will be covered with my assistant Taff. Starting with gangrene. Gangrene can happen mostly due to sepsis left unchecked. It can also be caused by leaving a tourniquet on a limb for too long or leaving an endovascular balloon in a patient without using a medical stent afterwards in case of aortic rupture. Gangrene is irreversible at 15% or over, so treat whatever's causing it and give antibiotics immediately. In the case it reaches 15%, you must perform an amputation. You do this by opening the limb with a scalpel, hemostat, skin retractors, then use your bone saw with the suture. A missing leg will halve your patient's walking speed, and a missing arm will, of course, cause your patient to be unable to perform anything two-handed, like holding a two-handed weapon or a crate. The leg amputation is worked around with the wheelchair, which will restore your patient's movement speed, but they will be unable to equip a diving suit or armor, so only use this on your way to the next station, where it's imperative you buy a replacement limb from the medical merchant. Another cause for amputation is traumatic amputation. Traumatic amputation is usually accompanied by a broken artery. If this is the case, tourniquet the artery before the surgery to minimize bleeding. Traumatic amputation can happen due to monster attacks, high damaging and piercing bullets, explosions, and things of the like. The good thing about this kind of amputation is the limb will be reattachable. In order to reattach the limb, carry out like normal. Use your scalpel, hemostat, skin retractors, bone saw, and then just throw that leg back on there by double clicking or dragging it onto the limb you're performing surgery on. Just remember, limbs need to be stored on refrigerated containers, or else the leg will deteriorate over time, and if its health reaches 0, it will disappear. If you don't have a tourniquet for the surgery, then just make sure you perform the surgery quickly. The bleeding artery will be fixed the moment the leg is reattached, and use a suture. Just make sure you have blood bags ready. An organ transplant must occur if an organ reaches 100% damage. Organ failure can be seen as 100% damage to an organ when using the health scanner on the torso. Causes for organ damage were previously covered, so I won't go over them again as it would take too long. In order to perform a transplant surgery, prescribe your patient azathioprine first. Give it some time to kick into your patient's system, then perform an open surgery. Scalpel, hemostat, skin retractors, then there will be a specific kind of scalpel you need to use in order to transplant the proper organ. Say you're doing a heart transplant, you must use your heart transplant scalpel, then immediately put in your patient's replacement heart, then close with the suture. When a healthy organ is placed into the body, it will immediately restore a large chunk of your patient's health. Just make sure you give azathioprine some time to work, or else your body could attack the organs and cause them to take a lot of damage, which will defeat the whole purpose of the transplant. Also remember when doing a transplant that there are two kidneys and both can be taken out. If you accidentally pull out a kidney that's in good health while trying to take out the bad one, just go ahead and shove it back in. It'll be fine as long as your patient is on azathioprine. Organ failure is a major emergency and must be treated immediately. Transplant organs must be kept in a refrigerated case, and they can be bought at medical merchants at outposts, or they can be taken from unconscious people. Unfortunately, you can't take organs from a dead person, as you can't operate on someone if they're dead. This is by far the most important episode, so cheers for getting through it. I hope you learned all you needed to know about trauma surgery, and if you still have questions, feel free to ask whatever you need in the comments. Even if it was covered in this video and you didn't see it, or you need further elaboration on something, I'm happy to answer. In the next episode, I will go over all of the tutorial scenarios with you guys and explain to you step by step what I'm doing, so stay tuned for that episode. And good job so far. Neurotrauma is hard to learn and take in, but if you're hearing this, you're dedicated to learning. The world needs more people like you. We stop living when we stop learning. Take care, watch out for mud raptors, don't steal your patient's organs. Happy sailing.